studying the two most important topics in the physiology, pressure volume loop and cardiac cycle. First, we will be starting with the pressure volume loops. Pressure volume loop is this black colored loop which is representing the normal cardiac physiology. It has different phases. Phase 1 is isovolumetric contraction, phase 2 is systolic ejection, phase 3 is isovolumetric relaxation, phase 4 is rapid filling, and phase 5 is reduced filling. So first, starting with the phase 1. Phase 1 is isovolumetric contraction. So in between the period, both the valves will be closed. Mitral valve is closed and aortic valve will be opening at the end of this phase. Okay, isovolumetric contraction phase, and it is the period between mitral valve closing and aortic valve opening, period of highest oxygen consumption. Then after the aortic valve opens, now aortic valve has opened, so blood will go from the ventricles into the aorta, so the volume will be decreasing. Volume is decreasing in the backward direction, and then after the blood has shifted from the ventricles into the aorta, then the aortic valve will be closed. Then again the volume will remain constant as both the valves are closed. Aortic valve is closed and mitral valve will be opening at here. So in this time period both the valves are closed in the phase 3. So it is isovolumetric relaxation phase. Pressure is decreasing and the volume being constant. Then phase 4 and phase 5. Phase 4 is rapid filling phase, period just after mitral valve opening. Just after the mitral valve opens, the blood will be gushing into the ventricle, so it is rapid filling phase, and slowly the volume of the blood shifting from the atria to the ventricles will decrease and reduced filling phase. I hope the 5 phases are understood. Then we will be seeing what all we can derive from this pressure volume loop. From this pressure volume loop we can see the end systolic volume and the end diastolic volume. And systolic volume is volume at the end of systole when the ventricles has relaxed or ventricle has contracted after the systolic ejection. Systolic ejection ends here, and what is the volume then? It is end systolic volume. Then relaxation. Before the contraction phase, the ventricle will be in the diastole, so end diastolic volume can be derived from this point. Then stroke volume is end diastolic volume minus end systolic volume, and ejection fraction can be derived from stroke volume by end diastolic volume. So stroke volume by end diastolic volume. Then we can see the variations in this graph. In this graph, if the preload is increased, then stroke volume will be increasing and end diastolic volume will be increasing. But if the afterload is increased, aortic pressure will increase, stroke volume will decrease, and end systolic volume shifts from here to here. So the end systolic volume will be increased. Stroke volume will be decreased. This much only stroke volume remains. Then if contractility is increased, stroke volume will be increasing, but end systolic volume will be decreasing, and ejection fraction will be increased. And ejection fraction, stroke volume has increased, end diastolic volume remaining constant, so ejection fraction will increase. These are the basic points about the pressure volume loops. Then coming to the cardiac cycle. First of all, for simplifying this diagram, we need to understand the phases. I will be explaining phase wise. First is atrial systole. Then after the atria has contracted, then we will be having the ventricular systole. Ventricle will contract. Then ventricles will relax. Ventricular diastole. Ventricular systole basically has 3 phases. Ventricular systole has 3 phases and ventricular diastole has 3 phases. Ventricular systole has isovolumetric contraction. First the ventricles will be contracting isovolumetrically, then rapid ejection, then reduced ejection. Similar is with ventricular diastole. Isovolumetric relaxation, rapid filling and reduced filling. Then we will be seeing the pressure loops. First, we will see the aortic pressure. Aortic pressure at rest is 80 mm of Hg. Then, after the aortic valve opens, then aortic pressure will be increasing to 120 mm of Hg, which will be happening in the ventricular systole when blood is being pumped from the ventricles to the aorta. Then, after the blood has been pumped, ventricles now will relax, so aortic valve will close. Aortic valve closes before the isovolumetric relaxation, as we have already seen in the flow volume loops that relax isovolumetric phases, both the valves are closed. So aortic valve closes, and then the pressure will be decreasing in the aorta. And before the relaxation phase, there is diacritic notch in the aortic pressure loop. This diacritic notch is due to the backward flow of the aortic blood which hits the closed aortic valve. So increased pressure is visible. Then after we have seen the aortic pressure loop, then we see the ventricular pressure loop. Ventricles pressure will be dependent upon the mitral valve. Aortic pressure was dependent upon the aortic valve opening and closing. Ventricular pressure will be dependent on the mitral valve. As the mitral valve closes, the ventricles will have increased pressure, because then it will be starting to pump the blood into the aorta. So increased pressure from about 0 mm, or nearly we can see near 0, it will be increasing to 120, and then it will be decreasing. So when it starts increasing, before the isovolumetric contraction phase, where aortic valve was open, here mitral valve closed. In this phase, both the valves are closed. Then we have the left. When will be the mitral valve opening? Mitral valve will open just after the isovolumetric relaxation phase. Okay, and then pressure again will be decreased in the ventricle. So this is also done. First mitral valve will close, then aortic valve will open, then aortic valve will close, and then mitral valve will again open. Like this we can remember. Then we have to compare the heart sounds. Heart sound S1 is linked with the atrial contraction, so it will be coming after atrial systole. Then S2 is related with the mitral valve closes, after that S1. Then after the aortic valve closes, we have the S2. Aortic valve closes, we can see from this diagram. Now we will be remembering like this only. Then S3 and S4. S3 is in early diastole and S4 is in late diastole. So this is also done, how the heart sounds are there with the cardiac cycle. Then ventricular volume. Ventricular volume will be increasing when there is atrial systole, and then after the ventriculars are starting contracting, then the volume will be decreasing, and it will again increase in the filling phase. Then right atrial pressure. Right atrial pressure or JVP loops. These have 5 waves: A wave, C wave, X descent, V wave, and Y descent. A wave is due to atrial contraction, so it will be coming after the atrial systole. Then C wave is due to ventricular contraction, it will be coming in the early ventricular contraction phase. Then X descent is due to the atrial relaxation and downward displacement of the tricuspid valve during rapid ventricular ejection phase. Rapid ejection phase. Then V wave is due to venous filling of the right atrium. Then it will be in the filling phase, and then we have the Y descent. Y descent is when RA, right atrium, is emptying into right ventricle. That will be also in the ventricular filling phases. Then we need to compare the ECGs with the cardiac cycle. As we know, P wave is due for atrial contraction, so it will be just coming before the atrial systole. Then is QRS complex. QRS complex is for ventricular contraction, so it will be coming before the ventricular systole. And T wave is for ventricular relaxation, so it will be coming before the diastole in the reduced ejection phase. This way we can learn to compare all the events of the cardiac cycle simultaneously. First of all, for making this graph, we need to know the phases arranged, then valves, how they are opening and closing, then heart sounds, by which valve closure which heart sound comes. Ventricular volume can easily be made from the filling phase or ejection phase. Then JVP waveforms and ECG. ECG, we need to remember that the electrical event is before the mechanical event. Okay, so S1 is at the mitral and tricuspid valve closure, loudest at mitral area. S2 is aortic and pulmonary valve closure. S3 is early diastole, best heard at apex left lateral decubitus, and normal in young adults, athletes, and pregnancy and children. S4 is in late diastole. It is also similar that a late left lateral decubitus and apex. High atrial pressure, ventricular non-compliance. It is normal in older adults and considered abnormal if palpable. Then JVP waveforms we have already discussed. So that's all. I hope I have succeeded somewhat in making this topic easier. Thank you.